Section 1. Cracking the code. Understanding the NCLEX client needs framework. Preparing for the NCLEX can feel like navigating a vast and complicated ocean of information with endless topics to memorize and skills to master. However, there is a map to guide your journey. The National Council of State Boards of Nursing provides this map in the form of the 8 client needs categories. These categories are the fundamental structure upon which almost every single NCLEX question is built. Understanding them is not merely a study tip, it is the single most effective strategy to stop guessing and start thinking critically, just as a safe, competent, and effective entry-level nurse would. These categories are your key to deciphering what a question is truly asking and how to prioritize your nursing actions. Let's begin this journey together, one category at a time, turning uncertainty into confidence. Section 2. Anchor Point 1. Management of care. The first category, management of care, is a heavy weight on the NCLEX, accounting for a significant percentage of the questions you will face. At its core, this category is about your role as the leader and organizer of the healthcare team. It covers the essential skills of planning, coordinating, supervising, managing the delivery of patient care to make it safe and effective. This includes making assignments for unlicensed assistive personnel, prioritizing which patient to see first, collaborating with physical therapists, collaborating with physicians, navigating complex legal and ethical dilemmas. Think of it as the air traffic control of nursing practice. The NCLX will constantly test your ability to prioritize. You're starting your shift and receive report on 4 clients. Which client should you assess first? A client scheduled for a routine dressing change on a healing surgical wound. B. A client with chronic obstructive pulmonary disease whose oxygen saturation is 91% on 2 liters of oxygen, consistent with their baseline. C. A client who had a total knee replacement yesterday and is requesting pain medication. D. A client admitted 1 hour ago with a new diagnosis of diabetic ketoacidosis who has a blood glucose of 550 milligrams per deciliter and is breathing rapidly. The correct answer is D. Section 3. Anchor Point 2. Safety and Infection Control. Our second category, safety and infection control, is the bedrock of all nursing practice. This area focuses on protecting both patients and staff. It includes hand hygiene, maintaining sterile fields and correct use of PPE, implementing precautions for tuberculosis and C. difficile, preventing patient falls, using patient identification protocols, and ensuring equipment is functioning properly. This category tests non-negotiable standards aligned with organizations like the CDC and the Joint Commission. Expect sequence questions for PPE, appropriate isolation, and preventing medication errors. Do not overlook hand washing. A nurse is preparing to enter the room of a client on contact precautions for MRSA in a wound. Which PPE should the nurse put on before care? A surgical mask and goggles. B. A gown and gloves. C. An N95 respirator and a gown. D. Gloves only. The correct answer is B. MRSA in a wound spreads by touch. Wear a gown to protect clothing and skin and gloves to protect hands. Masks and N95s are for droplet or airborne. Match precautions to the mode of transmission. Section 4. Anchor Point 3. Health Promotion and Maintenance. The category shifts our focus from treating illness to preventing it, helping individuals achieve their maximum health potential across the lifespan. This area is proactive, growth and development milestones, prenatal care, healthy lifestyle choices, and strategies for healthy aging. Patient education includes diet and exercise, immunizations, and guiding self-screenings like breast or testicular exams. On the NCLEX, no evidence-based guidelines, especially screenings and immunizations. Which statement by a new parent indicates a need for further teaching about infant safety? A. Place baby on their back to sleep. B. Crib slats no more than 2 3/8 inches apart. C. Keep soft toys and loose blankets out of the crib. D. I will use a baby walker to help my baby learn to walk sooner. The correct answer is D. Walkers do not help infants learn to walk and increase injury risk. Teach safer alternatives for motor development. Back to sleep, safe crib slats, and an empty crib are all correct safety practices. Section 5. Anchor Point 4. Psychosocial integrity. We care for whole human beings with emotional, mental, and social needs. This domain includes mental health disorders, substance abuse, coping mechanisms, stress management, therapeutic communication, grief and loss, and crisis intervention. On the exam, provide compassionate, non-judgmental, effective support. Choose responses that are open-ended, invite feelings, and show empathy. Avoid false reassurance, giving advice, or accusatory why questions. Client: I don't see the point in continuing, it's all hopeless. Which response is most therapeutic? A. Stay positive for your family. B. I can see this is difficult for you. Tell me more about what you are feeling. C. Why would you say that? D. Let's talk about something more cheerful. The correct answer is B. It validates feelings and uses an open-ended prompt. A. Burdens the client. C. Is confrontational. D. Avoids the client's distress. Open the door for honest, supportive conversation. Section 6. Anchor Point 5. The 4 physiological integrity subcategories. Physiological integrity is the largest, most clinically focused portion of the NCLEX, broken into 4 subcategories: basic care and comfort, nutrition, hydration, elimination, mobility, personal hygiene, and non-pharmacological pain management, pharmacological and parenteral therapies, dosage calculations, side effects, IV management, and responding to adverse reactions, reduction of risk potential, interpreting labs, monitoring for early deterioration, and prevention of complications like DVT and skin breakdown. Physiological adaptation, managing acute life-threatening conditions. Which post-operative assessment requires the most immediate intervention? A. Pain, 610. B. Small serosanguineous drainage. C. Swollen, red, painful cough. D. Absent bowel sounds. The correct answer is C. Classic DVT, risking pulmonary embolism. Pain and mild drainage can be expected. Ileus is common post-op. A suspected DVT is the immediate risk. Section 7. Your path forward. A simple strategy for mastery. We have journeyed through the 8 client needs categories, turning abstract concepts into actionable knowledge. Management of care is prioritization. Safety and infection control protects patients. Health promotion teaches. Psychosocial uses therapeutic communication. The 4 physiological areas span bedside comfort to emergencies. Use a teach-then-test loop. Don't just read, engage, create questions, and explain rationales. After pharmacology, write 5 questions on side effects and 5 on IV complications, then answer and justify. Avoid burnout. Study in short, consistent bursts, 1 category at a time. Draw the PPE sequence, sketch prioritization flows, and chart therapeutic versus non-therapeutic responses. Start today. Pick a category, teach it out loud, create 5 questions, and analyze every rationale. You can do this. For more information, visit www.brispinternational.com.